This video is part of the surgical series of education related to an open pre-peritoneal repair at Boston Hernia. Today's video is about post-operative day number 1. So you came home yesterday from the hospital. Today you woke up after a night of sleep. It may or may not have been a good night of sleep. But today is typically the most challenging day of the recovery. Let's first talk about pain control. It is really important to stay ahead of the pain and take Tylenol and Motrin together every 6 hours around the clock today. If you experienced zero pain, it's fine to take these medications as needed, but most patients have a pain level that they describe a 3 or 4 on this day and do benefit from taking that Tylenol and Motrin today, as well as maybe even tomorrow. Ice can also be an important adjunct, as well as Arnica Montana. I've mentioned this on previous videos. In terms of activity, we restrict activity for the first 2 weeks from heavy lifting, repetitive motion, bending, housework, yard work, but we do encourage leisurely walking as soon as today. We want you to go for a short stroll, whether it's around the block, whether it's in your own dwelling. It's important to move and not get stiff. In terms of diet, there are no special consideration. However, if for some reason you're taking opioid analgesic or you tend to run constipated, we typically recommend additional fiber around the time of surgery, or even a stool softener or laxative such as Senecot or Colace to help stimulate the bowel movements. This can be important to take up until you've had your first normal bowel movement after surgery. Typically, the phone calls that we receive in our office are oftentimes related to constipation. So you can get ahead of that on your own. We do get phone calls because oftentimes bruising, a swelling, or a bulge occurs after surgery, and it may be first noticeable on the first post-operative day or even the night before. So why does bruising, swelling, or a bulge occur? Typically this happens as a result of the surgery where we manipulate the tissue. The body tries to heal immediately after surgery. A few drops of blood will discolor the area and will cause some bruising. This bruising can head down through gravity, down to the genitalia area and down to the thigh. And the swelling or lump is typically fluid that your body naturally secretes to help in the healing process. Rarely is it a small blood accumulation underneath the skin. And all of these things are temporarily, will resolve on their own, but can be disconcerting. Oftentimes patients who've had 2 hernias, one on each side, will have more swelling on one side than the other. This could be due to the size of the hernia. It could be due to the dissection we performed, as rarely either side heals at the exact same rate. As long as that swelling or bruising isn't accompanied by new or worsening pain, that's a pretty normal part of your surgical recovery after an open pre-peritoneal repair.